I'm back!
I'm in here.
I swear they get younger every day.
Who's that, dear?
The staff at that nursery. The girl I spoke to this morning must be fresh out of school.
Oh, I'm sure she's perfectly capable.
I told you to leave that till I came back.
Oh, do stop fussing.
Until we hear otherwise, you're supposed to be taking it easy. Come on, sit down. I'll finish off.
The kitchen gloves are under the sink.
Where does it hurt?
My chest. This time, there's my arm too.
You'll be all right. Remember what the doctor said? Breathe slowly and deeply.
Hiya. You were gone a long time yesterday.
Hmm?
Did you go anywhere nice? Business or pleasure?
Look, just mind your own business, okay?
Mrs. Allen, thank you for coming in to see me. I've got your test results here.
I was thinking about my chest pains.
Yes.
I wonder if it's just fatigue. I mean, children are tiring for even the youngest of parents, and for Robert and me.
Mrs. Allen, the test results are conclusive. It's as we thought. You have angina.
Does that mean I'm going to have a heart attack?
No, angina doesn't necessarily lead to a heart attack.
What about surgery? I have a friend who...
Yeah, all heart disease is serious, but, well, your wife's case of angina isn't especially severe, and with the right medication, there's no reason why you shouldn't lead an active and full life. Now, we need to look at the risk factors. Tell me, do you smoke?
No.
Okay, well, I can see from your test results that you're reasonably fit.
Oh, well, I'm not about to run the London Marathon, but...
Is there any family history of angina?
My father suffered from it.
Okay, well, your cholesterol levels are a bit high, so we should probably look at your diet, see if we can lower that.
And the angina?
An aspirin every day. You can take that alongside the medication that you're already taking for your blood pressure. It's in your best interest to keep as active as possible, but I will prescribe you a GTN spray that you can use under your tongue if you feel the symptoms of angina coming on, or if you're going to do any strenuous exercise.
You see? I'll be right as rain in no time.
It's not the end of the world, is it?
I'm not sure your boss will see it like that. I mean, he's been very good so far. Letting he takes a day off and the odd half day here and there.
Let's go flexi time.
We can't take liberties. Anyway, you heard what the doctor said. I should stay active.
They'll leave the key in the same place. Well, Mum, Dad, aren't you pleased to see me?
Hiya, how'd it go? The therapist I recommended.
Yeah, well, it was kind of interesting.
Well, interesting. What, as in...
Yeah, Mac, look, I've got patients to see. Thanks, love.
There you go, love.
Thanks, Mum.
So, are you well?
Never better. Where's Willow?
At the nursery.
She okay?
Oh, she's fine. Into everything. Sticky handprints everywhere. She's so like you.
Where have you been? Last time we saw you, you were off with that druggy boyfriend of yours.
Robert.
I haven't seen Scott in ages. Went off with some mates to Mexico. Wanted to stay in Amsterdam a bit longer.
Oh, we got your postcard from the Greek islands, didn't we? Looked lovely. Blue skies, blue sea. I think perhaps we could do with a bit of that.
Oh, that was last year. I started off in Crete, then went island hopping up the Aegean, ended up in Halkidiki, worked as a waitress in a little fish restaurant.
Now you're back. Where are you staying?
With a friend on the other side of town.
How long are you going to be in the area?
Don't know yet. Have to see.
Would you like to see some photos? We had some developed recently. There's a lovely one of Francis at the zoo, chasing peacocks.
Francis?
Well, it was your grandmother's name.
It was only supposed to be a middle name.
you know what children are like. I didn't want her to get bullied.
She's called Willow,
Always thought it was a stupid name.
but I chose it. I spent so long a time thinking what it should be.
If you'd given us much thought, thinking about actually looking after your daughter, we wouldn't be in this position.
Robert, Maureen, please, let's not go over old ground.
I'd like to see those photos.
I can get them.
Didn't have to look after Willow.
We did. It was a simple moral decision. The alternative was our granddaughter going into care. Couldn't you see that?
Sometimes things get on top of you.
Yeah, right. That's when you have to fight all the harder.
Stiff upper lip.
Perhaps. I prefer the word commitment.
You know, when I was away and I wanted to remember home, it was always the garden I thought of. And the treehouse. Is it still there?
No, I had to take it down. It's too dangerous. Well, it sounds like you've become quite the traveller.
I love the freedom. Being able to follow your nose. Wake up somewhere new every day if you want.
Yeah, well, we have to settle down eventually. Settle down and start behaving responsibly.
That's kind of why I'm back.
Oh?
I've changed, Dad. Really, I have. I've not taken drugs for ages. And as for settling down, I suppose you could say I'm here to make a fresh start. I want Willow back. Hello, Millhouse Centre.
Good morning. It's D.I. Roth.
Oh, hello.
Could I speak to Dr. Robinson, please?
Yes, I'll just see if he's free. Hi, Greg. It's DR off for you. Okay.
What does she want?
Oh, yes, the old refrain. I've changed, Dad. It'll never happen again. Just one more chance.
What's going on?
Our daughter, after 2.5 years on the road, has decided she'd like another crack at motherhood.
I just want my daughter back. Is that such a terrible thing?
We weren't the only ones who reckoned you weren't fit to look after a child.
Francis is so settled.
Exactly. Have you even thought of the consequences?
I've given it a lot of thought. I want what's best for me and my daughter.
Don't you dare say what's best for Francis. We were the ones that picked up the pieces when you made such a hash of things.
It'll be different this time.
Have you any idea what you put Francis through? Or the pressure your mother and I have been under? No, of course you haven't. You've only ever been interested in yourself. Sorry.
Hello.
Hey, how's things?
Oh, you know, I haven't done my paperwork for just a couple of days, and now look at it. How are you coping with everything?
I went to see a counsellor yesterday. Max suggested I go.
Cool, good idea. Well, it doesn't do to bottle these things up, does it? Not with, oh, no, sorry. Forever telling my patients to turn theirs off.
Shouldn't you answer that?
No, it can wait. What was I saying? Oh, yeah. With the court case coming up and everything, well, you're going to have to prepare yourself for some pretty tough questioning.
Oh, that's not really why I went. It was something I need to do for myself. You know, when, No, I better let you go.
No, Ben, wait.
No, I can see that you're busy.
Well, maybe we can have a chat later, yeah?
Yeah, that'd be good.
Hello. Yeah, put him through.
Mo, it's been a long time.
Do you know you're the only professional person I know that doesn't call me Maureen? I'm impressed you remember me.
Well, your case was one of the first residence orders I handled, and they're complex at the best of times, but your case, it's stuck in my mind. How is your daughter?
She's fine. That's sort of what I wanted to talk to you about. I've just returned to the country, for good, I hope, and I want to have my daughter back. Now, I know it's going to be difficult, but I've sorted myself out, cleaned up my act. I went to talk to my parents. Dad just flew off the handle, wouldn't listen to a word I said. I suppose I'm just looking for some advice at the moment.
Well, if you go to the courts, their main concern is going to be for the welfare of your daughter. And given that social services have expressed reservations in the past...
Yeah, but I'm off the drugs now.
I'm sure you are. How long have you been clean? A few months?
7 weeks.
I'm pleased to hear it. But the authorities will take some convincing that you've changed. And they'll be interested in all aspects of your life, not just the drug take.
Yeah, but I'm Willow's mother.
Yeah, and the courts do generally prefer to keep the children with their natural parents, but your daughter's been living with your parents for quite some time, and no one's going to want to disrupt her now.
So it was pointless me coming back?
No, I'm not saying that. I'm trying to be honest with you. It'd be unfair to raise your hopes. Not yet, anyway.
What do you mean?
You can't rush these things. You're going to have to get a job, a place of your own. You're going to have to prove to people that you really have changed, that you can be trusted, that Willow will be safe with you if she stays with you. Now, you've asked for my advice. I think you should go back and speak to your parents again. See if they'll let you see your daughter a bit more often. I don't think now is the right time for you to be considering legal action.
Oh, Faith, I've got a message for you. The CPS said they need a word against us about the case. D.R. Roth?
I've come to see Dr. Robinson. Is he free?
I'll let him know that you're here.
There's no need. I know the way. You know the fire did you a favour?
Sorry?
This place. So much nicer than Riverside.
Dare you?
Where's Dad?
I was picking up Francis from the nursery.
I just wanted to say sorry for earlier, for turning up out of the blue. I should have warned you I was coming.
I admit it was a bit of a shock.
We are back!
Hello?
Did you have a lovely morning at nursery?
You don't know who I am, do you?
Come on. I made your favourite sandwiches for lunch.
I thought she'd...
What? That she'd recognise you after all this time?
I don't know, I hope there'd be something.
Still don't understand, do you? Life goes on, whether you're around or not. Especially when you're only 3.
So you just want me to leave you to it? Pretend I don't exist?
You can't just wave a magic wand and come back in here and expect everything to be all right again.
Just keep your voices
And what are you
down.
going to tell her when she's older?
We do the best for her like we've always done. Margaret? Oh, come on, love.
I'll be okay.
Sit down. Deep breaths. Yeah? That's... Where's your spray?
Coat pocket. In the hallway.
Mom, what's the matter? Mom?
It's good of you to see me at such short notice.
No problem.
I wanted to thank you for everything you did yesterday. I don't normally let these things get to me.
Well, your symptoms would have worried anybody. There's no change. But it's early days yet. Have you started taking the antibiotics?
Of course. I always do what my doctor tells me.
Good. In that case, the infection should clear up in a couple of days.
Well, I am impressed. Seems you might know what you're talking about after all, Dr. Robinson. You were right, of course. All I needed was an evening's proper rest.
Actually, you could have done with a few days off.
I'm afraid my colleagues wouldn't see it that way. Time off is a sign of weakness.
Sounds like the NHS. When I was a junior doctor, you actually had to be dead if you wanted any time off. And that was only admissible after a full post-mortem.
Well, if your work down at the station as a guide, you've worked like a Trojan ever since, you could afford the odd sickie here and there.
Yeah.
D.I. Roth, I am surprised to see you here.
Oh?
As a patient, I mean. You left us in no doubt how badly run you thought the practice was, so I'm surprised you chose to come here. But then again, I'm surprised that you let yourself be ill in the first place.
Hey. You okay?
I'm just all over the place at the moment, Greg.
Well, that's understandable. You've got a very stressful job.
I'm hardly going to be much use questioning suspects if I keep bursting into tears all the time.
But we're all allowed a day off.
I'm not!
See? That's better. Another 5 minutes and everything's going to be back to normal. You'll have suspects and colleagues quaking in their boots.
Seriously, I am going to be okay, aren't I?
Yes, you're going to be absolutely fine, I promise. There's nothing to worry about.
You won't tell anyone down at the station about yesterday?
No, of course I won't. I wouldn't have the guts.
Oh, much better, thanks.
Mom, what's going on?
Oh, just a funny turn, nothing to worry about.
Didn't you call the doctor?
Don't be silly, I'll be fine.
Dad?
As your mother says, she gets a bit out of breath occasionally.
Now, Robert, perhaps you could turn the television on. One of Francis's favourite programmes will be on shortly.
I did what you said. I went back to Mum and Dad and tried to talk to them.
Well,
and,
that's good. I'm pleased to hear that.
And I thought I ought to tell you, when I was there, Mum had a funny turn.
Okay.
And it made me think, I mean, I don't want my mum to be ill or anything, but if she's not well, then surely that's going to help me get Willow back.
I suppose it might.
Yeah, and, you know, looking after Willow, I mean, that can't be doing Mum any favours.
But it's not as simple as that. A concern about your parents' health isn't automatically a plus point for you.
Yeah, well, I was wondering about maybe...
Listen, Mo, from what you say, there might be grounds for your optimism. Okay, but it's more complicated than that. And right now, I need to be somewhere else, so perhaps we could talk about this later.
Yeah, sure.
I'm sorry I'm late.
Don't worry. I had to go ahead and order a starter. I hope you don't mind. Do you want some?
Anchovies?
They're a good source of calcium, iron, and omega-3 fatty acids.
I've never liked anchovies before.
Well, I've never been pregnant before. And before you start, any jokes about eating for two are strictly off limits.
Okay, I'll remember that.
How was work?
Interesting. Do you remember Maureen Ellen? Drug addict and not the most disciplined mother.
My parents are patients of mine.
Yeah. Well, Mo's not a bad person. She just couldn't handle looking after a child. Thank you. Anyway, she came to see me today. Apparently she's off the drugs and she wants her daughter back.
Do you think that's a good idea?
It's hard to say at the moment. Did you see much of the parents?
Not until recently. They were very keen to tell me how well the little girl was doing, though. Mrs. Ellen's been poorly.
Really? Mo did say her mum had a bit of a funny turn earlier.
You see, that's what kids do. They're little bundles of stress wrapped up in skin and smiles.
Hello, my name's Ronnie Woodson. I was wondering...
You're Maureen's solicitor.
I represented her in the past, yes.
I remember. You always seemed very fair. Well, I'm afraid Maureen's out at the moment.
Actually, Mrs. Ellen, it was yourself and your husband that I wanted to see.
Well, you better come in.
Thank you.
Robert. Robert. Mr. Woodson, Maureen's solicitor.
Hello.
She's been to see you already, has she?
Yes. I can't really talk to you about what we may have discussed. In fact, I shouldn't really be talking to you at all.
Worried about your fee, are you?
No, since Mo is my client, she might object. I said during the original case that my only interest was what was best for Mo's daughter, and that's still true today.
Good. Then perhaps you'll understand our position.
Thanks, sweetie.
We've been looking after Francis for 2.5 years now. It's not been a doddle, but we've done the best we can. Made sure she was fed on time, had decent clothes to wear, sat up with her when she cried through the night, took her to the doctors when she was ill. And at last, she settled. Happy even. Then without warning, Maureen turns up, wants to go to the courts, uproot Francis from everything she's been used to.
I'm here because I don't want to see your family dragged through the courts again.
It's typical of Maureen. She just wants her own way, and to hell with the consequences.
Well, Mo says she's changed, Mr. Ellen.
Just words. I want evidence. I've been let down too many times before.
Do you have children of your own, Mr. Woodson?
No. Not yet.
They're small for such a short time. Before you know it, you're thinking, whatever happened to that little baby I used to have? Every moment is precious.
I've got things to do.
when Mo came to speak to me earlier, it was obvious she's very concerned about her mother.
When I think about Maureen, all I can see is more stress, more anxiety.
It doesn't have to be like that. If you'll forgive me, I think you're pretty hard on your daughter.
Yeah, perhaps. You know, I don't regret looking after Francis. Not for a moment. I only hope to goodness it hasn't contributed to Margaret's illness. But if the decision was mine to be made again, I'd not change a thing. I couldn't stand by and see Francis going to foster care. We've been blessed, Mr. Woodson. Sitting up, first steps, first words. We've been there for every milestone. And, yeah, always at the back of our mind is...
You thought it should have been Mo.
It must have hurt her. I just have to keep reminding myself, it's her fault we're in this mess.
Mo's just looking for a second chance to see more of her daughter.
Margaret was always worried about what would happen. When we became old, if we were too ill to look after Francis, and Francis ended up with Maureen, and then Maureen wasn't able to cope. This time, there'd be no alternative to Francis going into care. And that, Mr. Woodson, is why I'm so hard on my daughter. Just isn't worth thinking about.
No one wants to see Francis taken away from you. But there is a limit to what you can do yourself, Mr. Allen. Especially now your wife is ill. But if you were to allow Mo to help out...
She doesn't have a clue.
No, you could guide her. You could show her how to look after Francis. Mo could take some of the pressure off your wife. Francis would still be safe. The courts wouldn't need to get involved. Much less stress all round.
You back then?
Why have you come?
I wanted to have a word with your parents.
I see you brought Francis something.
Yeah, I hope you don't mind.
Of course I don't mind.
I know this isn't going to make everything okay between us, but...
I've been talking to your father about Francis. I think we all agree we can't sort this out overnight. Decisions about your daughter are far too important to be rushed.
Mind you, I wasn't the one who strolled in here threatening legal action after gallivanting around Europe for 2 years.
Mo assures me she's off drugs. She wants to settle down. She wants to get a job. Now, I admit these are only first steps, but...
We're going to need all the help we can get. And the one thing we always criticised Maureen for was not asking for help.
This is different.
Is it? I think we should at least tell her the test results. We can't keep on pretending there's nothing wrong with me. Maureen, I'm afraid I've got angina.
What? Well, you're going to be all right, aren't you?
I must admit I have felt better.
I've been suggesting to your father that there is a way forward. Your parents are going to need a bit more help around the home, and you want to see more of Francis.
Are you going to let me move back in?
I suppose to be all right. On a temporary basis, just to start with.
And I've always kept your room ready, just in case.
And I want to see if you've changed. And I want to spend more time with your mother.
Thanks. You won't regret it.
Promise?
I'll make a start. Looks like someone needs to go to bed.
Thanks for your concern. I'm not quite sure where we go from here, but at least things aren't as bad as they seemed earlier.
Oh, I'm just grateful I didn't make things worse.
Oh, don't be so modest, Mr. Woodson.
Her name's Francis.
Not gonna hurt to pull a willow from time to time, is it?
I'll leave you to it.
Fancy cup.
Okay.
I took your advice. I went to see a therapist. Mac recommended someone.
Right.
The whole thing, it was really odd. It was like staring in a mirror and seeing the worst part of yourself staring back.
Look, Ben,
What?
I'm sorry, but I just don't want to hear this.
Yeah, but I thought...
Look, what's happened, it's got me so confused. Twice now, you've lost it. I mean, lost it big time. I don't want to hear you justify what happened.
I'm not justifying anything.
I can't get involved. I've been giving statement after statement, and it's getting so confusing.
Yeah, but you of all people must understand what I'm going through. Look, why don't we talk about this later, after work?
No, Ben. Not now, not this evening, not anytime soon.
So you're just going to bury your head in the sand and hope it all goes away?
You know what, Ben? That is exactly what I want to happen.
Alfie and Little Mo outed, and Zubin faces his fate at the hands of the inquiry. BBC One's The One for drama tonight, EastEnders at 7:30, followed by Holby City at 8.